Okay, so I think we can go ahead and get started. Hopefully, there's I see a lot of people on. It's hard to see exactly who, but I think we can go ahead and get started just to not run out of time. I want to thank everybody for being here. We have members from the Assembly on both sides. This is truly a bipartisan effort. After all of our speakers are introduced and speak, we will then open it up for members of the press if they have any questions. Everybody is muted, so I'm asking the press, if you have any questions afterwards, to please use the raise hand function, and I will be looking for that. So then I will call on you and we will get you unmuted. So again, now I'll just get started. I would like to welcome everybody and thank you all for being here. This press conference is basically to urge the governor to reverse the cuts that are being imposed on the intellectual developmental disabilities community. We're announcing a billboard campaign, which my colleagues from NYADD will go into more detail about afterwards. But it's myself, Assemblymember Tom Abinanti, Assemblymember Ed Ra, and Assemblymember Aileen Gunther, who really do advocate very, very strongly for this population. We're all here together with NYADD, with Bob Carpenter, with Russell Snaith, and Trish Calandra, to ask the governor to really consider, for once, cutting the services and supports to this community. It's not a secret, it's COVID. A lot of things are getting cut. We're all aware of that. But this is not an excuse to continue to keep stripping our community of the supports and services that we need so desperately for our individuals, our loved ones, to be successful integrating into the society and communities, live independently. There are so many ways that these cuts impact our loved ones that, and quite honestly, they are never a priority in this state, and that has to change. We don't want to go back to Willowbrook. The days of Willowbrook where everybody's locked in with no programs, no supports. That's going the wrong way. So that's why we're here today. We have this billboard campaign that we're going to speak about, and these cuts, a lot of these cuts were implemented on October 1st. So we're here to speak about the direct impact that it's having on our loved ones. And that's why we've invited you here today, so we can spread this message. First, I'm going to ask Tom Abinanti if he can say a few words. They'll have to unmute you, Tom.
Okay, are we there? Can you hear me, Missy?
Yep.
All right. Thank you for joining us today. I'm just scrolling through to see who else is here. I noticed that Michael Montesano, Assembly member from Long Island, is here, and Marianne Buttenshine from somewhere up in upstate New York. I always get lost as to where Marianne is from. But I'd like to thank both of them for joining us, in addition to Ed Ra and Aileen Gunther. I don't know if I've missed anybody else. Maybe Missy, you want to look through and see?
I don't see anybody else, but I do know that other people were going to try and join in. So at some point they may.
Well, we're talking about issues today that affect everyone. We're talking here about people with disabilities, but just about every family in New York State has someone in their family who's affected by some type of a disability. And if you follow the facts, if you follow the science, you see that New York is not doing what it should be doing for people with disabilities. I will say, my opinion is, we have gone from the benign neglect to active abandonment of people with disabilities. And it's all about money. It's all about money. The initial budget this year, as proposed by the executive branch, proposed cutting programs for people with disabilities and shifted a significant amount of money out of the Office of People with Developmental Disabilities into the Medicaid budget, then proposed cutting the Medicaid budget. So it was a way to cut services without leaving any fingerprints. And by moving everything to Medicaid, as this executive has done over the last few years, it's limited access to services to those people who are the poorest. And if they're not poor, they have to become poor so that they cannot supplement the lack of programs that they get through OPWDD. And now we have a crisis, a pandemic, that has exaggerated this even more. And let me just take a quick look at 3 areas. Number 1, we have a policy of isolationism. We have an isolation policy. As a result of COVID, we now have mandates from the Department of Health which limit parents and other loved ones from visiting their loved ones, people with disabilities, in whatever type of location they're at, whether it's a group home, whether it's some kind of a facility or whatever. They're now limited. And we know that the mental impact on people who have a disability is very, very significant. This is psychological torture for them. They don't understand why their loved ones aren't coming there. And we know that mental state affects physical state. And we know that when caregivers, family members, participate in giving care, the care is better. There are another set of eyes around to see what's going on. And it's very clear. The facts are there. The science is there. When family members show up to help, the care is better. Now, secondly, we have a crisis of capacity. We've depleted the personnel, so much so that if you take a look at the access policy that just came down from OPWDD, you will see that while parents cannot visit a loved one at a group home, if there's COVID at the group home, or the parents have had COVID in their homes and don't test negative, the personnel, the staff, don't have to follow the same rules. The regulations that have come down specifically allow for those staff who have been exposed to continue working. The regulation specifically says that they should quarantine when they go home. But there's an exception. If there is a possible shortage of staff, then they can go to work. So in other words, the policy is it's okay to expose people with disabilities to COVID, but it's not okay to expose the rest of the world. To me, that's discrimination. To me, that's making the same mistake as was made with our nursing homes. So that's the second point. Isolationism, a crisis of capacity with rules that don't make any sense. And lastly, let's talk about the money itself. There is a 20% cut that has gone into effect for state monies, and there's a reduction of Medicaid monies, a straight reduction. If for example, and one of my colleagues today is going to talk about it more, but if someone leaves the facility or leaves the group home to go home for the weekend, there is a reduction in the amount of money that group home will get. And that makes absolutely no sense. It's discouraging taking your loved one home for the Thanksgiving holiday. It's creating more isolationism. And it is impacting the entire stability of the system that was carefully built to help people with disabilities. So I suggest that what we're seeing is COVID has become an excuse to eliminate services. We see a transfer of decision-making from OPWDD, which is supposed to be an advocate for people with disabilities, to the Department of Health and to the Department of the Budget. And as I said, I see that money is driving policy and benign neglect is turning into active abandonment. Missy?
Thank you. Next, we're going to ask Assemblymember Gunther to say a few words. You have to unmute her, please.
Good morning, everybody. And Missy and Tom, thank you for all you do and your advocacy. And I hope that our words, again, do not fall on deaf ears in the executive branch, and even for our leaders, both in the Assembly and in the Senate. You know, this is really the time not to cut money from a fragile community. You know, it incenses me that as I talk to parents like you, Missy, and you, Tom, that we're cutting services, that we're decreasing the amount of care that our folks are giving by taking our loved one home for the weekend. The facility is punished. I think that the whole system needs to be really looked at by people with compassion and understanding of the DD community. And in order to do that, they have to pick the right people to direct the legislation and to talk about cuts, but yet they do it on their own, sometimes behind closed doors and really behind other really cloaked systems that they use to take away more money. You know, right now we have made it possible for people with disabilities to live a longer, fuller life. That's what we've done. I look at the Center for Discovery. I look at New Hope. I look at these places, and now we're going in the opposite direction. What is wrong with this picture? People like Missy and Tom and all the people that come to my district to visit their children at the center or New Hope, they love their children. They are citizens of New York State, of the United States, and they deserve quality of care. And it is our responsibility as citizens, as parents, as legislators. And I don't know, Missy couldn't be clearer day by day, nor could Tom Abinanti. They have pleaded, but I guess it's fallen on deaf ears. And I think that whatever plan we come up with, it's got to be one that is going to ring true with more than just the Missies of this world or the parents or the grandparents. It's got to hit the second floor and say, what the hell is going on? And that's what I have to say.
Thank you, Aileen. And we're now going to hear from Ed Ra. If you can unmute Ed.
I don't think they.
There we go. I got it. I wanted to struggle to unmute it because it was tough enough to follow Aileen there. So I needed a couple extra seconds. There's really not a ton to add, but you know, Tom Abinanti, Missy Miller, Aileen Gunther are just fantastic advocates for this community. You know, I'm proud to work with them. But at the end of the day, what I really want to say is, you know, I have an individual with special needs who lives in a group home who calls my office several times a week, you know, and I've been speaking to him for months about these issues, whether it was before the homes were opened up for visitation. Now he calls me on a regular basis as the holidays were coming up, asking about the change in the funding that Tom Abinanti spoke about. And his ability to visit with his family. And he's very concerned with it because he wants to be with his family when he can be, and his family wants to have him with them, but he doesn't want to hurt the home he lives with and the agency that runs it and the staff. That's really, really a difficult position to put people in. At the end of the day, I don't think we're doing everything we could do with maximizing the resources that have been provided to us, you know, both in the CARES Act and other things. You know, it's one thing to look at a situation. There's no doubt we are in a difficult budgetary situation, but it's one thing to look at it and say across the board, we're going to withhold X percentage. But when you're doing something like that across the board, you may be looking at an equal percentage of being withheld, but the impact is not equal in any way. The impact falls the strongest on the people that are most vulnerable. And that's what's happening here. So I thank everybody for, their continued dedication to be a voice for the voiceless, and let's keep it up and make sure that we make this population a priority, and we make sure that that voice is heard. Thank you.
Thank you, Ed. I just want to also welcome, I see a couple of other Assembly members here. We have Brian Manklow and Carl Brabenek are here joining us. And I'll just follow up on what Ed said. Look, we all know the state is in a dire situation with its budget. It was even before COVID, and it's only, 1,000 times worse since then. But the honest truth is, this is about priority. And as I said earlier, this population has never been a priority with this executive branch. And they need to figure out where else to move around money. They can move money into this. They can reprioritize our loved ones because we know they're worth it. So next, I'm going to have, we have our representatives from NYADD, which is NYADD. They're the reason that we're even doing this press conference. It's an enormous advocacy group of families that I am so proud to be a member of. And I'm going to introduce Russell, who's one of the founders of NYADD, Russell Snaith.
Got it. Thank you very much, Missy. Can everybody hear me? So I wanted to just start off by saying that the summary that Tom provided, I think was brilliant and very cogent, spot on, covered the three major concerns that we're looking at here around safety, staff decimation, and funding. So as Missy said, my name is Russell Snaith, and I'm the founding member of NYADD, the New York Alliance for Developmental Disabilities. We have over 5,250 members right now, statewide and growing. And this group actually just spawned up in May. And it was really a response to COVID and the urgent and dire need to advocate for individuals vis-a-vis lockdowns and family visitation. We represent individuals with special needs, their families, and other stakeholders. So that's why it's so wide with over 5,000 members and growing daily, because it effectively runs from Niagara Falls to Montauk. It's all folks across New York State, all regions, and anybody involved or that has a stake in this. It's not just families, it's behavior specialists, it's special ed teachers, it's transportation drivers, it's everybody. So I myself, I have a 24-year-old son who resides in a group home on Long Island who receives excellent care that I do not want to see compromised or whittled away. And that's a great concern right now. I just want to reiterate and state that it's an honor to work with a truly bipartisan group of elected officials here. So, Tom and Missy and the other elected officials on this call, I want to thank you and commend you for being here. There's a lot of things going on right now in society, in this state, in this world. It's a holiday week, and the consistency of your presence and appearance in these forums and your work in this space is greatly appreciated. It really shows unity across the aisle and the way, to me, public policy and government should be done. So thank you. I'm here today to tell you about the devastating cuts to residential services and how they impact providers and families. There's a number of impacts here that just cut across the gamut. We understand the fiscal times that we're in and the need to be efficient. There's no two ways about that. There's not a money tree. There's no unlimited funds coming from the federal government to the states and vice versa. But when it comes to the care and well-being of those with developmental disabilities, they are not simply a budget line or a cost savings opportunity. They have to be personalized and cannot just be looked at dollars and cents and an opportunity to make a budget. It's personal. These are people. There are real impacts and consequences when they are not acknowledged or prioritized in state government and budget setting. Service providers have been cut to the bone and its population continues to be ignored. This is a perfect storm. And this is just something that's going to brew, and there's going to be an implosion and a tsunami of effects here on this population, and it's going to ripple across the state and society. Service providers have been cut to the bone, and this population continues to be ignored. Providers will fail, and services will be lost, which endangers the safety and well-being of this population. That we may have too many service providers. There may be opportunities to consolidate and become more efficient and gain scale, but we have to have the service providers thriving and be vibrant, properly funded and enabled to provide these services. We're very much aligned with them. And if we do not fund them properly and we don't have proper staff, then we jeopardize the folks that are in their care. Their safety is at risk. In the latest round of ongoing cuts, residential services were particularly and egregiously targeted. These services are absolutely vital to individuals and families. These are the services that individuals in our state, typically with the highest needs and supports, require. So this is the absolute last place you should be cutting. I'm telling you, this is the absolute last place that we should be cutting. The consequences and damages are profound. These cuts call for reductions in reimbursement to providers from 50 to 100% of their rate for days that individuals are hospitalized or when they visit their families and sleep over for weekends, holidays, and vacations. These are therapeutic leaves. These are essential for the mental and emotional well-being of individuals, family continuity, roots, stability. When an individual is hospitalized, there's actually an increase in expense to an agency, a provider, because they've got to have somebody at the hospital around the clock to be by that individual's bedside. So the premise or foundation of these cuts is completely flawed from the start in terms of the economics and then the ethics, which I'll talk about shortly. So I want to focus for a minute on the cuts for when a loved one sleeps over at their home, their family home. To cut funding to service providers for these days is outrageous. And the incentive it creates and the position it puts providers and families in. It's when you think about it, you're discouraging families from taking their individuals home to sleep over. You're putting agencies in a precarious spot between a rock and a hard place to dance around that and not directly discourage, but at least provide information to families about the impact to the agencies when these individuals are taken out to sleep over. And it's real financial impacts that these agencies, will suffer. The cut certainly serves to discourage home visits, family interaction, and in effect isolates individuals. This is unethical at a minimum. And I'm saying that very clearly. It's unethical at a minimum. So you take it from there and figure out where the maximum is. As a society and civil, humane people, we cannot accept such policies and cuts. Savings must be found in other ways and funding must be preserved. We have come a long way from the dark days of Willowbrook, but it feels like it's getting a lot darker to me these days when I look around me. Isolating people with special needs brings us back and damages them emotionally and physically. There's a lot of data, empirical data and evidence about the emotional and physical fallout of the isolation and lockdowns. There's a lot of data about behaviors, medication changes, and physical injury. We have seen increased depression, anxiety, and aggressive behaviors. The toll is real. So we're not, we're talking about money and nebulous things around budget lines and paper and dollars, but the toll on people here is real and people have to know it and feel it. We also must never prevent an essential family member from visiting their child, even during times of crisis. They must absolutely have equal standing as staff. If a staff member can be tested by a temperature check and answering a few questions, so should an essential family member. They're equally as important as staff. In summary, NYADD opposes these cuts to residential services due to the adverse impacts they pose on providers and bad incentives they create to isolate. These cuts affect provider operations and their ability to pay and retain staff. That puts our individuals in peril. These cuts also certainly fly in the face of ADA and Olmstead Act provisions, which promote community integration versus isolation and institutionalization. Folks, we made a U-turn and we're heading right back in that direction. And I hope this message gets out loud and clear to the governor and to the top people in the state that we made a U-turn somewhere along the way and we're heading right back to Willowbrook, okay? As a state, society, and people, we are simply better than this. And I just have a couple of other comments I'll make that are a little bit more off the cuff. So we are essentially being ignored by the governor, and we want his attention respectfully. We appreciate what he's up against and what he's doing, but we want his attention. We want him to focus on this and acknowledge this population. Cuts force terrible trade-offs and bad incentives. Safety and well-being is at risk. Staff pay is low. If you're paying staff to provide direct support services to individuals, the same amount of money you could make working in McDonald's flipping burgers, that really tells us a lot about society and how we value the work people do. Double standards, nursing home staff are tested, group home staff not tested. We cannot find savings on the back of individuals with disabilities. How we treat the most vulnerable people in society defines our character and conscience. So I implore everybody on this call and all of the stakeholders, the legislature and the governor, to pay attention to this population. This is a perfect storm brewing. And if we keep defunding and cutting them, the cost to rectify this is going to be 1,000 times more than it is to fund them properly. So thank you very much for the time today, and I'll go back to Missy.
Thank you. One of the points that Russell spoke about, actually, Tom and I are working on legislation with their input, with all the families' input, to make sure that every individual that's in a group home or in some kind of living environment, independent living environment, that they're allowed to assign an essential person, somebody from their family, somebody that knows them, whoever that may be, that they are entitled, just as Russ said, staff can come in and go, family can come in and go. Families are part of that care plan for every individual. And they don't live there, by themselves with no family contact. The families are the ones often who take the best care, who are instrumental to their emotional well-being, not just the physical well-being. And so that is in the works. So it is something that we're working on. Next, we have Trish Calandra. If you can unmute her.
Can you all hear me? Okay, great. Hi. Good afternoon. My name is Trish Calandra. I am a self-direction broker, which it's not what people think brokerage. I'm not here to sell a home, and I'm not here to fund money to people. I'm here for the best interests of people with developmental disabilities to have the best part of their life. So I'm here to discuss the 20% withhold to self-directed state service dollars. Now, self-direction is a program that was created by OPWDD in its design first to save money and also give people with intellectual and developmental disabilities the freedom to choose their services and days through the principles of person-centered planning. We are so getting away from person-centered planning. I agree with everyone who has spoken previously. How is any of this person-centered? The sweeping 20% withhold to these state dollars is having the biggest impact specifically to those individuals living independently in the community who may not have any family support. This OTPS section assists people to pay for essential housing services like utilities to power and heat their home, cell phones that keep them connected to family, friends, and especially their staff, internet safety, internet services that they need for telehealth staffing and support for doctor's visits and just connection to the overall world is crucial. It's sustaining safety and health, especially with the expected severe outbreak coming this fall and winter. This withhold could mean the choice of having electricity and utilities to stay warm or a connection to the world. A really crazy and unfair choice to have to make. This truly needs to be reconsidered for these individuals who are living alone in the community first, and to keep this a person-centered plan of service that OPWDD claims to be utilizing in this state, and to ensure that they're not creating deeper later issues that people just can't come back from. The rental subsidies that at first were part of this hold, but are safe, but only until December 31st. I mean, how many people, when I bring this up, will say, you know, it's okay. They decided not to enforce this, but really it was only until December 31st. So we're living in uncertainty still. So this withhold is a quarterly decision that will have grave concerns if it does become applied at year's end. These people have years-long leases and are legally responsible to pay for their full rents. This will be catastrophic to that they may face eviction or homelessness, or even worse, the need for crisis emergency housing at really a much greater cost in the long run. The facts here are the housing subsidy is already not substantial enough and has not been raised in almost 10 years to the HUD guidelines that they say they go by. Most of the people are already having to pay 50% or more of their only income of SSI, which is only about $800 a month. And those who were employed prior to COVID may no longer be working to help supplement what was making it all work for them. There are only 6,505 people with intellectual and developmental disabilities receiving a rental subsidy statewide, information that we have foiled less than 4 months ago through the self-direction. So this will be an easy fix and not necessarily for this small number of people. Again, facts that the governor consistently wants to hear. We have an effective solution. We need an effective solution instead of being told and held hostage to, you know, advocate to the federal government. That'll help you, you know. This is this no thought sweeping plan of withholding everyone 20% has created overall anxiety and a threat to people's mental health, and it's just unacceptable. The self-directed programs are making it harder to live independently, despite this being the more cost-effective and fiscally responsible program compared to the congregate group home settings that it was intended to start and do. Thank you very much. Back to Missy.
Thank you, Trish. And you touched on something that I see somebody in the chat had also said. When those cuts go into effect and individuals aren't allowed to go home, or they're not, getting the services or the programs that they're used to, their behaviors increase. They have, more emotional or agitation. They can even have failure to thrive, not want to eat. So that increases the risk of hospitalizations in this population for secondary problems due to the cuts and due to the isolation that they're facing. So it's introducing another cost that is, unnecessary for sure. Next, we're going to hear from Bob Carpenter. Are you there, Bob?
Yep. I'm here. Can you hear me?
Yes.
Okay, great. Thank you so much, Missy. Good afternoon, and thank you all for joining us here today. My name is Bob Carpenter. My wife and I have a 23-year-old son with autism who lives in a group home here in Long Island. The cuts you heard about today are deep and they are damaging. Some of us who are old enough to remember Willowbrook and know what happens. They know what happens when this most vulnerable population is neglected. For those who are not, Google it. But I have to warn you, those images you will see are disturbing. It was Governor Cuomo's father, Mario, who championed the closing of Willowbrook 33 years ago today. I'm sorry, just last month. It is our hope that his son, Andrew, follows in his footsteps and reverses the funding cuts you heard about here today. Let's not go back to Willowbrook. NYADD, in a true grassroots fashion, collected a large number of small donations from its members in order to rent a digital billboard space up in Albany to show our message. NYADD reached out to its over 5,200 members for messages to see that they wanted to see on the billboard. The 3 messages that started cycling at midnight last night were selected via a poll held by the regional leads at NYADD. This huge 48-foot digital billboard is located on the southbound side of I-787, 3/4 of a mile south of I-90. The messages will be rotated in and shown on the billboard well over 5,000 times over the course of the next 3 days leading into Thanksgiving. That's once for nearly every member of NYADD. I hope the governor and the state of New York hear our plea. Thank you, everyone, for showing up today. We really appreciate it, and I hope everybody has a happy and healthy Thanksgiving.
Thank you, Bob. We have a couple of members here that would just like to say a couple of words. I see Brian Manklow, he had his hand up, and then after him, Mike Mantasano. If anybody else does want to say anything, please use the raise hand feature, and then we'll get to the press if they have any questions. But for now, Brian Manklow.
Thank you, thank you, Missy. Can you hear everyone hear me okay? Thank you so much. And anybody that knows me, I'm a numbers guy. I know how to work numbers. I know how to get through struggles, but above and beyond that, I'm a person of integrity and a man that cares for each and every individual of this state. And what the state is doing right now is what the state is doing right now to these family members and their loved ones is just appalling to me. We should be in Albany. We should be back there as legislators, working with our governor, deciding what is the most important thing that we should be looking at. Where should the money go? Not the 20% across the board, because as we've talked about, and many of the people I represent, we have loved ones that 20% should not be a cut in their lives. These individuals are beautiful people that care, that want to be out there, and these family members. We should be doing everything we possibly can as legislators on both sides of the aisle to be back in Albany, making priorities of how we're going to spend money, not only to finish up this year, as we move into the financial crisis of next year. So I just want to applaud Tom and Missy and all the other individuals that spoke today. I have your back. I'm with you 100% on this, and we need to do this for these families. And when we sit in Albany and make decisions, we had better surely think about these individuals, and I will do everything I can to make that happen. Thank you.
Thank you. Okay, Mike Mantasano, and then Marianne Buttonshaw would also like to say a couple of words.
Okay, thank you. And good afternoon, everyone. Missy, Tom, thank you very much for what you're doing here today. And Aileen, you know, I agree with everything that was said today. And Tom, you hit the nail on the head before with the valid of the rights of these people in these residential homes. And Russell, the same issues that you pointed out. So I just want to go in a little bit of a different direction. Missy and Tom, I look forward to supporting this piece of legislation that's going to come out in dealing with the matters that you discussed, the essential, the person being designated as essential to each resident. And this 50% cut is just ridiculous on top of the 20% cut, because the expenses of the facilities remain the same, whether or not that resident goes home for a day or two. But as we're going to start legislating things and hopefully get them done, and the speaker lets them come to the floor for a vote, I just would ask the organization, NYADD, and the other organizations that are out there, sometimes, the governor responds to a different type of threat, and that is a lawsuit in the federal courts. So since the actions that OPWDD has taken under the governor's direction, and you pointed out that we have the Olmstead Act and the ADA law, which come out of the federal system, the organizations should think about joining together and bringing a lawsuit in the federal court to get a stay against the 20% cut and the 50% cut that was even the creation of OPWDD itself. Because legislation is going to take us a while to get it through committees, hopefully get it to the floor for a vote, and nothing says the governor can't veto it. And I don't know if we have enough to override the governor's veto. But these are serious issues that need action now. And if the organizations got themselves together, and I know it's money, I know it gets expensive, to file a federal lawsuit, I think that brings the governor to the table much quicker with the legislature to get this matter resolved and get rid of a lawsuit. It's happened before and has to happen again. And I'm not one to, to be litigious and stuff like that. But, the governor lately has just been marching to his own drum and doing what he wants to do arbitrarily without taking any advice or input from the legislature. Even during this COVID situation, with the actions he's been taking, he pays no attention to the legislature. So that's just my 2 cents, that you might consider this on top of things that we'll be doing at the legislative body. But it's going to take a period of time to do that. And in the interim, the financial damage and emotional damage that's going to be done to these organizations and to his residents are not going to be easily undone. So thank you for having me and letting me speak. Thank you, Missy.
Thanks, Mike. And can you unmute Marianne Buttenshaw? Thank you.
Thank you very much, Missy and Tom, for bringing us together. I support my colleagues as the comments that have been brought forward are sincere, and we need to collaborate together to ensure the health and safety of all residents that reside in homes that are to provide the ultimate care for them. As we know, individuals that live within various homes need the care. To all the agencies that are on that provide that care, thank you for working in these situations that provide so much, so many challenges that you have overcome and continue to overcome. I do look forward to the legislation that you're bringing forward in regards to an essential care person that can be there for the family members. And clearly, it is unacceptable to say that someone that wants to go spend time with loved ones, the agency or home would be held accountable by not being funded during that time that the person is gone. Obviously, utility bills remain the same. Staffing needs to be at all levels at all times. So again, thank you for the opportunity to be here, and thank you again to the family members that provide that care, as well as the agencies that are here today. And I look forward to working with my colleagues. Take care.
Thank you. Now we're going to open it up for any press. Is there any press here that have any questions? I will look, and we are trying to figure out if we can screen share the billboards. We're trying, it can't be in the current view that we're in, so we're trying to figure out how to put that up at the end of this. So does anybody have any questions? I see Muriel Horowitz has a hand raised.
Yes, I had my hand raised before. I do have a question, but I'm very sorry to see that my legislators are not here. I'm the mother of a 51-year-old son with Down syndrome who lives on his own. And as he's getting older, I'm very frightened by as he needs more help, there's less help coming down the pike. And the private agencies that are trying so hard to keep our folks as independent as possible and to give them agency seem to be the ones that are suffering most. And I wonder why it is that the private agencies are getting these cuts when the state agencies, from my understanding, are not. I don't mean any ill toward the state agencies. I'd like them to all get the funding, but yeah, I just feel this is really an important issue to look at. And thank you very much for having this. This has been very informative, and yeah, and it's been really worthwhile for me as an advocate and as a parent, and I hope for the legislators who are on here.
Thank you. Okay, I don't know if automation has figured out how we can share the billboards yet. Okay, if you hang out 1 second, I'm going to send it to them, and then they'll hopefully be able to share this.
Hey, Missy, does Bob have a copy of it in paper? Just hold it up to the screen. Hold it up.
He doesn't.
Oh, okay.
So
You
I'm
can
gonna,
print it out and hold it up, you know, in this modern age. I just want to add a comment if I could while you're doing
go
that.
right ahead, sure.
I think Mike Montesano made a point that's worth repeating. You know, in effect, what we're doing here is discriminating against people with disabilities once again. We don't tell senior citizens that their rent is going to be reduced if they go visit the family member. We don't tell college kids that their rent is going to be reduced, or even that their scholarship or their loans are going to cost less or whatever because they're not on the college campus. We don't make adjustments like that for other people in life. Why should we do that for people with disabilities? When you're living in a group home, that's your home. This is your new family. In many cases, group homes have couples. People get married and they live in a group home together. Why are we discriminating against them? Why are we saying that if something happens or if you get sick and have to go to the hospital because the staff person who's come in may have been infected somewhere else and now you have COVID. So now you're going to go to the hospital. A staff person is the only one who can visit you at the hospital. And so now the group home has one less person to help all of the others. And the home is going to be supported with less money. That makes absolutely no sense. And it's discrimination against people with disabilities. And let me also say that, you know, the agencies are highlighting how they're not getting enough. The monies that staff are being paid are clearly not enough money. They're having great difficulty getting staff. And I'm not quite sure yet, but I don't know that the raises that the Assembly has appropriated are actually being paid. I don't, you know, I'm getting some indication from agencies they haven't yet seen those monies. And if that's the case, they're not even doing what the legislature put in. I want to check that out and see, but I've gotten an indication from one of the agencies they have not yet seen those monies. So we are having a real problem here. People with disabilities are being discriminated, excuse me, being discriminated against again. Aileen wants to say something. Can we unmute Aileen?
Unmute.
There we go. You're
Hi.
unmuted.
Hi. So I just wanted to talk to you about a case that I have been dealing with. And this is like an example of the craziness of some of, and Greg is helping us with it. But this is an example of some of the craziness that goes on in this world. So a mother called me. She lives in Arizona, Florida, excuse me, and she's over 80 years old. And the mom calls me, and her son, who is in his 50s, has been in an apartment for many, many years and has really acclimated himself and has a routine for daily living, et cetera, et cetera. And then what they do is with folks like this is they evaluate them on a yearly basis. Am I right, Missy? I think I am. And so when he was evaluated this time, and the gentleman has been in this living situation for over 20 years, Rachel? Yes. Over 20 years. Over 20 years. So, and Greg is helping us, but this is, you know, we know, and this woman knew to call us, and this is what's happening in the DD world. What they said was because he went up 1 point, that he didn't have the same funding available, and they wanted to transition him to another situation over 1 point. Now, the disruption in his life would set him back probably 10 points. And so we have to fight, and we called Greg tooth and nail. And these kinds of rules and regulations without any thought, you know, when we look at the DD community, and I'm listening to this 80-plus-year-old mom, and the injustice that is going to be done or trying to be done to the son is absolutely ridiculous. And he might have even checked the box by accident, and it was the right answer. So it's ridiculous after testing somebody. And along with the not funding, some of the antiquated rules and regulations. I mean, come on, it's time to look at this as a whole and say, we got to do what's right for these people. And I mean, I'm just incensed by this one case that Rachel is sitting over there is dealing with, and we're doing everything we can. And again, Greg Roberts is helping us, but the ridiculousness of me working on it, Rachel working on it, Greg Roberts, and the mother, a nervous wreck, came back to New York from Florida.
And he has a heart issue.
And then, wait a minute, and the guy has a heart issue. So this is what's happening in the world of the DD community. It really is quite pitiful.
And Aileen, those are the ones that know to reach out to an elected official for help. How many don't know that they even have that ability, that they can ask for a change or ask for a reconsideration? Or so it's just, it's quite the, you know.
You got to get people in the trenches. You got to open your phone lines and listen. You got to listen. You know, I wish Governor Cuomo would come and meet Oliver and your husband and you. And, you know, if you don't understand the things that people are going through, and even, you know, creating a placement for your adult child, or, you know, making sure that when you're aging out, that there's pieces in place to make sure that quality of life is there. It's a whole myriad of things that, you know, you have to, you know, I think about it with my own children as a single parent, what's going to happen, you know, what I have to do to set up myself and my children, etc. But it's triple the burden for a parent of a child with disabilities, and getting them into that place that, you know, wow, I can sleep at night. And, you know, I'm just saying that cutting the money is really, it's a draconian thing to do. And, you know, I'm certainly with you, Missy. And, you know, we wish we could get the whole Senate and the Assembly to stand up and say, you know, we understand cutting 20%. But not to essential services, not to essential services. And these are life-saving services. And, you know, that's what it's all about. So that's all I have to say.
Thank you. We have, I see there's a question from Christy Murray.
Oh, here it is.
Hi, can everybody hear me?
Look at this. Look at this. Hurry up. Come around. What?
Wait, they're just sharing the picture of the billboard.
Sure.
Reverse special needs funding cuts. Embrace the season. Wait, hold.
That's most appropriate considering the governor's comments at his press conference last week to not be a turkey. So. Okay, thank you for sharing that. Okay, so then there was a question from Christy Murray.
Can everybody hear me?
Yes.
Okay. My name is Joe Murray. I have a 21-year-old son who's in a group home in Westchester County. Is there some place that I can go to? I don't know, maybe NYADD or somebody that has a list of specific cuts that are coming down the pike, so I can see, you know, on paper exactly where the cuts are, so I know how to respond to it. And number two, is there a letter writing campaign to our legislators? And what is the best way that we should, as parents, go about reaching out to our legislators so we can have this addressed appropriately, legislation? And I think also that bringing a lawsuit against the state is also a very good idea.
With the exception of that last part, pretty much everything else you mentioned can be found on NYADD's Facebook page, okay. and it's easy enough to connect with Bob or Russell, who are the founders, and they have all kinds of files and are, you know, full of information. So I would suggest you go onto that Facebook page.
Okay. And as far as, is there any type of letter writing campaign that has been started by parents?
Yeah,
or
there's that
organization?
also. There was Russell just had
Okay.
one up the other day. Yep. they're
Okay. And I just want to thank you all for putting this conference together. I think it's very helpful. So,
thank you.
Thank you.
Okay, and I see Ellen Alexander has a hand up.
Hi, I just wanted to take a minute to say that I'm 81 and my son is 52. So I'm not the lady from Florida who called you, but I am a representative of an older generation. The lack of ability to visit or the lack of ability for him to have family was devastating. What I do want to say is that when he was young, we were told that he would most likely end up in a place like Willowbrook. That were the only options. And we fought all these years to get an education, to get the group home, to develop everything. He's been in the group home for 28 years now. That's his home. And whether or not a person belongs in that home, belongs in a different home, belongs in an apartment, or one number up or one number down, really has to be in the hands of the agency, not the state. Because I'm not going to be here forever, and I'm not going to be able to fight. The people who run the agency that he's with know him, and that's where our trust is, and that's where we're going to have to hope that he'll be cared for. His brother's in California. We have very little options other than the trust we have in this non-for-profit agency, and we have to support them. So the cuts that are going to them are very detrimental. If they can't continue the services, we're all going to have a lot to face. So that's really my message. And also the salaries for the DSPs has got to be worked on. That's got to be a primary thing. These are the people who have everyday contact with our people. I feel blessed that he has such a good life. I never would have dreamed it when we were young. And I feel blessed that all you young people are here to keep the fight going and to support the future. Thank you.
Thank you very much. Okay, so I think that's it, unless I was really hoping anybody from the press would have had at least a question about the billboards. But if I don't see any other hands raised, then that will be that. So thank you everybody for coming. Thank you for helping us advocate. We won't stop. Thanks.